Okay, open your eyes. So in the West, particularly in the United States, when we talk about meditation, then very often we say, "Oh, yeah, there's the Zen meditation, there is the mindfulness meditation, and then there is something called the Vipassana meditation." Particularly the Vipassana meditation. The Vipassana meditation, we have in California, we have 3 Vipassana center. And when you enter, you're committed to a 10-day practice where you have to adhere to what is called a noble silence, where you cannot speak, you cannot even make eye contact with anyone. And it's you have to maintain your vegetarian diet, no reading, no yoga practice, no nothing, just sit. And we call that the Vipassana practice. And then there's something called the mindfulness practice, where you're taught to pay attention to your breath, the in-breath and the out-breath, right? So if you've seen my latest upload a video where I talk about mindfulness literacy as a competitive advantage, I mentioned that movie called 13 Lives, directed by Ron Howard, which talks about the rescue of the 12 kids plus the coach who are trapped in a cave in Upper Thailand. And in there, I cut out 39 seconds of video where the teacher, the coach, was teaching the children how to pay attention to the breath. That starts with saying that all your anxiety, all your fear come from inside, not outside. And it's time to focus on our in-breath and out. Okay, so we typically call that the mindfulness meditation, as different from the Vipassana. And then, of course, there's a Zen meditation, which is the Japanese meditation that comes from the Soto traditions, where you sit. Okay, this is like the blind man trying to figure out what the elephant looks like. That one guy grabbed onto the tail, and he says the elephant looks like a tail, it looks like a string. The other one wraps it around his leg and says the elephant looks like a tree. And then finally the one says, oh, the elephant is very sharp, by looking at the tusk. Because Buddha, after he became enlightened, he was 35 years old when he became enlightened. Then he spent the next 45 years teaching. And so we often talk about Buddha has 84,000 ways towards enlightenment, towards what we call the enlightenment. And the reason there's 84,000 is if you take 45, the number of years that he had to teach, you multiply that by 365, and then you assume that he has to sleep for at least 4 hours a day. So then what's left is enough for 5 classes. Then you multiply all that together, it's 84,000. Which means that he was able to have enough time to teach 84,000 different audience. In each audience, he taught it slightly differently according to the student. And so if you happen to be one of the students and he taught one way, then you think that was the way. And then you have another student that was taught another way, and you think that was the way. So let me explain to you that Vipassana means contemplation. You have to contemplate when you're mindful to your breath, and you have to contemplate when you practice Zen. You cannot just say this is contemplation and those are not. Contemplation is everything. Mindfulness is everything too. And Zen comes from the Chinese word chan, which comes from the word chana, which comes from the Sanskrit word called jhana. It means sentimentation. It means to renunciate your material existence. And you have to do that in everything. So what we did, sitting 30 minutes, is what we practice in the Vipassana meditation. But in this case, you have to actually practice mindfulness and jhana. Okay? It's just that you're mindful of your body. In particular, you're mindful of the feeling of the body. And you have to accept that that feeling is impermanent. So you have to accept the feeling. You have to let go of the feeling. then you're back again, accept the feeling, and let go. Ultimately, what you're practicing is equanimity, right? All right. So now before we do the second one, where we are being mindful of a breath, but at the same time we have to practice vipassana, which is contemplation, and we have to practice Zen, which is enunciation, right? It's just that in that case we're more focused on the breath. What we just did is more focused on the feeling of the body. Before we do that, let's come back to the question that Martha asked, which is, what is it that we can do here that will help with my high blood pressure? Okay, let's focus on that. Let's focus on that. Now, high blood pressure is not a disease, it's a symptom. It's the most serious symptom. High blood pressure is something that you really have to pay attention, because the cause of that is so immense. Not only that, but because the Western science treat it as a disease, so they give you medicine to knock down the symptom. It's as if they're trying to murder your only weakness, just to silence you. I remember there was a joke a long time ago, and the joke was that a young person was walking down the street in the middle of the night, and he saw an older person, on his floor, on the ground, looking for things. And he thought, wow, I should help this person. So he walks over and says, nice gentleman, what are you doing? Can I help you? And the older gentleman says, I lost my key to my car. I can't get home. I have to find it. And the young man says, oh, I can help you. I have good eyes. And I even have an iPhone that has a flashlight. Let me do that. He says, where did you lose your key? He says, I lost it over there. And he says, so why are you here? He says, because there's light here. That's Western medicine. That's Western medicine. Western medicine, the Western doctor. I'm not saying anything bad about them. I'm just telling you what I know. The Western doctor is the only profession where they get the retraining from the vendors. Imagine that. Their entire career as a medical doctor, they had to go back for retraining. And what is that retraining? It's conferences that are put out by the pharmaceutical industry to tell them what drugs are available. Those are the vendors. So when you go to the doctor, they don't actually try to cure you. They just try to match your symptom with a medicine that is in the catalog. So if you go there with high blood pressure, they will say, oh, I got this medicine. It will knock it down. Next time you go there and say, your high blood pressure normal. You're happy, he's happy, the drug company's happy. What's wrong with that? So what causes high blood pressure? It's both a supply and a demand problem. Supply meaning that you're not supplying enough oxygen to your brain. Your body says, well, that's bad. That's the worst thing you can do to your body, not give oxygen to your brain. What good is that? So it senses the blood flow here, right? And when it sees that you're not getting enough oxygen into your brain, it tells your heart that you better work harder. Okay, so that's a supply problem. You're not supplying enough oxygen to your brain. So you can fix that by improving your circulation. And we did that with the joint exercise. We're going to do some more. So doing some more stretching. The other problem is not the supply, it's the demand. Demand means that you are constantly in a fight or flight. You have lost the harmony in your autonomous nervous system. You're stuck on the fight or flight. You have lost the art of the rest and digest. And as a result, you're pumping so much cortisol and adrenaline into your body that your body is at war all the time, pumping up your high blood pressure. So we need to fix that by relieving your bad chi, right? And we're going to talk about that. So then the question is that why do you have so much stress hormone? Because your body needs it. Your body needs it. It thinks that you're in danger because you're constantly in stress. So this next statement is about relieving yourself of stress. Okay? So think of this as a as if you're going into a rehab, okay? You're going through rehab and you're trying to reduce your chemical addiction, namely the cortisol. So I want you to relax, learn to relax, okay? This is one of the most important things you have to do. It doesn't matter whether you have high blood pressure or high cholesterol or that you're so overwhelmed with stress that you can't perform at work. It all comes from stress. So let's learn how to relax by activating our vagus nerve, starting at between your shoulder and then work into our body. Focus on the top of the shoulder. Bring up your shoulder. Now stay focused on the top of your shoulder. Bring it up to the ear level. Now I want you to open that shoulder as if you're putting a tennis ball between your shoulder blade, and I want you to squeeze that tennis ball as you come down. And as soon as you come down, I want you to relax. Then we're going to continue the circular motion by leaning forward, closing your shoulder. I want you to lean back. I want you to lean forward, eyes looking at the floor. And then I want you to bring that shoulder up again. Eyes now looking at the camera. And then I want you to open that shoulder, eyes are looking at the ceiling, and then come down. Okay? Continue. Forward. Up. Open that shoulder. Relax that shoulder. Completely relax. Completely focus on your shoulder. Forward. Now I want you to coordinate with your breathing. Close your mouth and just breathe in very gently. Breathe in. Open the shoulder. Now I want you to breathe out. And I want you to breathe out completely. Breathe out as if you're releasing all your negative energy. Now I want you to come in. Breathe in. Accepting all the positive energy in the universe. Open that shoulder. Breathe out. Relieving yourself of all your suffering. Breathe in. Open the shoulder. Relax. Breathe in. Open the shoulder and relax. Now I'm going to chant in Pali, the original language of the Buddha. Consider this a blessing from Buddha. Bless you with the most important positive energy of the world, which is that of loving kindness. I want you to bring that loving kindness to yourself. Breathe in. Open. Breathe out. Just follow me. Sabi Sata Suki Hantu Sabi Sata Suki Breathe in. Open that shoulder. Breathe out. One last time. Breathe in. Open that shoulder. And then breathe out. Now, the next one. We're going to sit properly again. Open the shoulder. Relax. Lean back the forehead, tuck in the chin so that the top of the head, this energy point called the 100 beat, is on top of your spine. I want you to take your right hand, put that on your left hand side of the head. I want you to pull your head towards the right, but fight it with your neck so you're not changing your posture. I want you to feel the stress on your neck. As if you're, when you're doing laundry and you have to squeeze this water out of your clothing, that's what you're doing now. Squeeze that stress out of your neck. And then I want you to slowly release all that stress. Then I want you to take the left hand, put that on the right side of your head. Once again, pull your head towards the left, but fight it with your neck. Feel all that stress on your neck. Feel it as if you're squeezing the last drop of water from your laundry. And then I want you to relax, let it all go. Then I want you to put both hands in the back of the head, sit up straight, and then look down. Now I want you to put half of your energy on your fingers, bring down your head. Then I want you to use the remaining half energy and lean back, so you're fighting it. Then rotate towards the left. Feel the stress on your neck. Come back in the middle, and then out to the right. Come back in the middle, and then very gently relax. Sit up straight, lean back the forehead, tuck in your chin. Now I want you to lean back your forehead as if you're completely weightless. Then rotate the head to the right, rotate forward, rotate to the left in a clockwise direction. Now back to the back, and then go the other way, to the left, to the right, to the back, and then sit up straight. Okay? Now next thing we're going to do, we're going to massage these two energy points called the wind, palm of the wind. Now these energy points are the one that I showed to Martha that would help you to reduce your blood pressure, okay? Because in this case, we're actually improving the blood flow into your head, all right? So we're actually helping you with the supplies, with the demand side, okay? With the supply side, putting more oxygen into your brain. And so open your shoulder, relax your shoulder, putting your fingers, locking your fingers, put it right behind your head. Now take the two thumbs. Now you feel that you have like these two muscles, right? Okay, so now put it outside the muscle. You see the cavity? All right, so now use your thumb, push down, and then that's half of your energy. The other half is on your neck, lean back your head. Now just keep pushing it. What you're doing is you're restricting the chi going through your gallbladder energy line. Okay, just keep pushing. Now you can feel it. You can feel the numbness, the tenderness, a little bit of pain. Just keep pushing and then relax. That's all you need to do. It's all you need to do, right? Because you restrict the chi and you let go of the chi goes to the top of the head. Now we take the right hand, use the 4 fingers, put it on the left, right, where we were before, this cavity right here. Now push down with your 4 fingers, lean back your head, maintaining the pressure. Now I want you to use your right hand and pull it without losing skin contact, okay? Pull it to the right. And then relax. Take that side, press down, lean back, maintaining the pressure, and then pull it to the left. And then relax. So this is a good energy point. This is a good massage point for improving your blood flow into your head. So if you improve your blood flow in your head, then your heart doesn't have to pump so hard. Your blood pressure will come down. One thing before I forget, if you have high blood pressure and you're taking medicine and you're practicing here, be careful. You should go out and buy a little device, put that on your wrist, okay? And make sure that you elevate your hand so that it's the same height as your heart. So you need to sit down, put some pillow, and you measure your blood pressure. Before you take the medicine, after you make the medicine, not necessarily every day, but every other day. Because as you practice, what was high blood pressure should be lower now. But then if you continue to take the same amount of medicine, it will get too low. And then you start to have a lightheaded, okay? So make sure that you monitor. And at some point you say, hey, I'm pretty good now. And then you can go to the doctor and says, doctor, you did such a good job. My high blood pressure is going down. Can I take less medicine? And the doctor says, yeah, go ahead. No problem. I am so good. Okay? Now you feel a little tingling on the top of your head, right? Because the blood flow is coming up. So I want to do two things. One is the massage, and the other one is the tap on the top, okay? Because this is another energy point that will help you with high blood pressure. So I want to take 5 fingers, put the 4 fingers on the top and 1 finger to thumb on the side, and just massage to the back of the head, all the way down to your neck, and then relax. Second one, go up, down, and then relax. One last time, go up, down, and then relax. Okay? Now, open your shoulder, lean back your forehead, tuck in your chin, take 10 fingers, put that on the top of your head. Okay, get ready. Fingers vertical, huh? Get ready, go. Okay, now massage again. Okay. All right, so now that is to improve the blood flow in the top of your head, because we have these three very important yang energy line. We have the one in the middle called the governing that goes along the spine to the top of the head all the way down to here. Then we have these other two that has to do with the gallbladder on the side, and then in between is the one that has to do with the bladder. These are just names, right? They're abstract names. And so that would improve your blood flow. Now the other thing we want to do is we want to reduce the stress. Okay, remember the supply and the demand. All right, so now a lot of stress is trapped into your eyebrow right here. So what we want to do is we want to learn to massage your eye. So you take your index finger, you put that in front right here at the beginning of the eyebrow, but it has nothing to do with the eyebrow. It has something to do with the little dimple right here. Okay. Now I want you to put some pressure on that by half of it on your finger and half it on your neck. Maintain that pressure. You feel numbness, a little tenderness, and then relax. Now put your fingers in between and then just like squeeze all that stress out of that eyebrow, right? There's 3 energy points right here. Squeeze, squeeze. And then I want you to take your thumb, put that underneath, and then just massage. Again, back to metta, loving kindness. And then now go the other way, massage. Okay? All right. Now, so we see we're going back and forth, right? We're going for circulation, and then we come back to stress. So again, it's a supply and demand, right? So if you have too much demand, you have high blood pressure. You have too much. If you don't have enough supply, you have high blood pressure. If you're putting too much of a demand on your system, then you have high blood pressure. All right. So now what we want to do is we want to learn to massage some very important points along the hand to help you with high blood pressure. This time is improving the supply. Okay. So it has to do with this energy line called the lung energy line. This is the yin energy line. Then together with that is the yang energy line that has to do with the large intestine, right? All right, so now what we want to do is we want to start on this one, and there's an energy point right here. So think of your thumb coming down right here. So this one is good for your high blood pressure. Okay, then the next one, come along, and then right where the joints are, there's another one. Okay, now if you tend to fold your fist, your elbow like this, then there's one right here. This is actually for the large intestine. This is also a very good one for improving your high blood pressure. This is all about improving supply, working on your lung. Okay, so you supply more oxygens to your brain in particular and throughout your body in general. Now go to the other side. Again, this is the lung. So come down in the fold right here. Come around here. Upper part. So imagine you have 3 and then this upper part right here. Now fold up your arm and then it's right here. Okay. All right, so those are the 3 that you do if you're concerned about high blood pressure. But in general, we also want to massage our fingers, right? Because the fingers are the origination of a lot of energy. It would help with your immune system, and it would also help with your state of mind, which is the heart. Okay, so first what we're going to do is we're going to learn to pull our fingers one at a time. Okay, now we call this, the fingers actually tied to all your internals. Then we're going to learn to massage the fingertips by squeezing both sides of the nail. Okay, these are things that you need to do, right, to improve your harmony. Then you want to take the left hand with the back of the hand facing up. Then you use the other side and you want to squeeze the fingers and rub them together like this. Now go the other way. And then there is exercise that we do that is, we're actually taking the pinky. There's a meat part here. Put that together. And then now the other side, same thing on the other side. This is good for, one is for your heart and one is for your lung. And then we do one more exercise, one more point, and only because it's gotten so famous in TikTok. And it's right along the thumb. It's similar to the other one, but it's right here. This would help you sleep. Okay, but I would be remiss if I don't show you this. Okay, so finally, it's the center of your palm. So we want to put the palm together, sit up straight, and then put them together. This is the energy point, the only one in the body, out of 365, that actually generate energy. And then now, once you put that on your eye, without touching your eye, you feel the infrared energy coming from your center of your palm, healing yourself. Not so much the first time. Your eye says, what's going on? Infrared. Haven't seen that in a while. Okay, now put that back. Oh, you feel it now, right? One last time. And put that. Oh, yes. Okay, now put the center of your palm over your temple, right? This energy point. And then now just massage your face and just tell yourself, relax. And then massage the front of your face. Massage the top of your head. Massage the neck. And then now we're going to learn to massage your ear. So put a thumb, separate the ear into 3 parts. Put the thumb on the upper part, squeeze. Put the thumb in the middle part, squeeze. Turn your hand around, put the index finger inside the thumb behind, squeeze. Squeeze the tip, squeeze the edge, squeeze your earlobe. There's one more exercise that we do that if you're concerned about high blood pressure, you take the index finger, you put that behind, and you just massage behind your ear. And then you take your palm, you put that behind, and you stretch, and you relax. Okay? So that's for the upper part, all right? Now, Martha also asked me to do Yi Jing Jing today, and so we can't do everything. So let's spend 5 minutes. We have 5 minutes before Yi Jing Jing. So let's do the other part of high blood pressure, right? Again, for high blood pressure. So let's go to a lower body. And we're going to tap on the outside. The outside is gallbladder. Again, it has to do with wind. Wind has to do with the nerve system to the top of the head. So this would help you with high blood pressure. Not only that, these 2 energy points would reduce your chance of having a stroke. Get ready? Go. Now the other one. Okay, now then we have 3 energy points below the knee. The first one right here. So if you go up like this, you can't go anymore. It's right here. Okay. Now this one actually would improve your immunity. Go ahead. Okay, now the middle one is actually, this is the gallbladder, so this has to do with the bile. So this would help if you have constipation. Okay, get ready. And below. Now this one you feel a little tingling on your toes. So if you have issue with gout, this would help. And then always one energy point, only because it's from 7 to 9 in the morning. This is has to do with the stomach. This is the time when the stomach energy point is very active. And so what you do is you measure 4 fingers from the kneecap, and then it's outside the bone. Get ready, go. Okay, now the next thing we're going to do again is back to the high blood pressure, and this time is we're working on the demand side, not the supply side. Demand meaning that we want to reduce the amount of stress hormone that we have in the body. And so we work on the energy line that has to do with the liver, and the energy line that has to do with the kidney. So the liver, so the energy point that we want to focus on is in between the toe and the second, and then you come in about 2 to 3 fingers, and you just push down. If you can't see it, let me rotate so you can see it. And you just push down. It's very sore. Okay, very, very sore. Okay, and then you just massage that point. Okay, because the stress hormone, the first is the recipient for the stress hormone. Now, what you want to do is you want to massage both sides of your toe, and then massage the middle. Okay, so this would help with your stress hormone. And then finally, we want to work on both the center. That's a very important one. That's the kidney. Okay, and then so we've done this before, so it's familiar to you. So what we do is we bend the toes back. We make an empty hand. We put that together. Okay, this is called mixing the water and fire. Get ready, go. Continue. Okay, now we're going to walk on the other side. The other side again, starting between the toes, and then press down. Oh, that hurts. Press down some more. Massage on the side of the toes, both sides, and then massage underneath. Then we do the mixing of water and fire. Get ready, go. Continue. And we're done.